Good afternoon, everyone. Welcome. We are so happy to have you. Thank you for joining us today. My name is Karen Bell,
and I'm an Associate Director for Partners for Advancing Health Equity, or the P4HE Collaborative for short. We are based at the Tulane University School of Public Health and Tropical Medicine, and we are sponsored by the Robert Wood Johnson Foundation. We're a national research learning collaborative that aims to bring together various sectors that are working on health equity, including government, academia, community-based organizations, philanthropy, and the private sector. We convene these sectors to work together to better understand critical issues related to attaining health equity. One of the ways we do this is by providing spaces for activities to engage with these groups and insightful conversations on timely topics and to promote actionable solutions. Today, we are going to focus on that last sector that I mentioned, the private sector. We will discuss balancing businesses' social responsibility, profitability, and community investment with our panelists. We know that health and all of the things required for enjoying a healthy life should be considered a basic human right, but not everyone has equitable access in our society. To structurally combat this, cross-sector organizations, including businesses, must first acknowledge the current state of health equity within the communities that they serve. Business owners and entrepreneurs can then move toward building equitable, socially responsible action plans that highlight ways their companies and staff can become community partners. Today, we are bringing together voices to speak about for-profit businesses and not-for-profit organizations of various sizes and their health equity vision, goals, and how to balance having a successful business with social responsibility and community investment. Before we hear from our panel, though, we want to hear from you. What do you think about this? Because P4HE is a collaborative, we know that all of our members and participants have valuable opinions and critical insights on health equity. As always, we want those to drive today's conversation. So to do that, we will be using Mentimeter, which you can access by scanning the QR code on your screen or by going to www.menti.com on your browser or mobile device and entering the code 77006600. So I'm going to do that as well so that we're all on the same page. So you just go to menti.com, put in this code that's on your screen, and hit go. And from there, do you have the instructions? You should see a thumbs up on your screen. You can hit the thumbs up that's showing up on our screen live here. And in a moment, you will see our first question to get us started thinking about how business and the private sector can be involved in our overall goal of health equity. Right now, we want to thank you for sharing. You can, like I said, continue to do so through the chat, but you can also do so on social media. You can join this conversation with your questions and comments both during the webinar and after on Twitter by using the hashtag partners4HE. Okay, so now I actually do want to introduce our panelists. First, we have Dr. Chandra Tettleton. Dr. Tettleton is the Director of Project Management at the New Orleans Business Alliance. Dr. Tettleton supports the development, implementation, and process management of several cultural, tech, and food systems projects. Her work also includes endeavors to retain support and showcase how businesses are thriving in New Orleans. She is a graduate of Xavier University of New Orleans. Dr. Tettleton's master's and doctoral studies concentrations at the University of New Orleans Political Science and Urban Studies Department include public policy, urban studies, and in her doctoral studies, she concentrated on community and economic development and gentrification. She is also well-versed in FEMA emergency management, statistical data analysis, and geographical mapping. Welcome. Next, we have Tawana Thomas Johnson. She is the Senior Vice President and Chief Diversity Officer and serves on the American Cancer Society's executive team. In this role, Ms. Thomas Johnson leads the standalone diversity, equity, and inclusion team and is responsible for inspiring and defining the organization's diversity, health equity, and impact strategies. She has extensive experience and expertise in strategic planning and operations management, volunteer partnerships, and corporate development. Her leadership responsibilities also include the development and execution of the environmental, social, and governance strategy and performance reporting. Ms. Thomas Johnson's ongoing role also includes engaging corporate executives, high-level donors, and leadership volunteers in furthering the fight against cancer through mission support and resourcing. Under her leadership, the American Cancer Society, has engaged with thousands of diverse volunteers, partners, and stakeholders to advance health equity. Welcome. And then lastly, we have Tawanda Muzingi. Dr. Muzingi is Director of International Programs at the Plant-Based Foods Institute. He is a food scientist, nutritionist, and a development expert working with the Plant-Based Foods Association's Plant-Based Foods Institute as the Director of International Programs. Dr. Muzingi recently joined the Plant-Based Food Institute from RTI International's Innovation Advisor Group, where he was an innovation advisor in the food and agriculture practice. Excuse me. You have a lot going on here. Let me finish your bio. Prior to RTI, Dr. Muzingi established effective collaborations for work on food systems, biofortification, and nutrition-sensitive agriculture in Nairobi, Kenya. Dr. Muzingi obtained his PhD in biochemical and molecular nutrition and master's degree in food policy and applied nutrition from the Gerald J. and Dorothy R. Friedman School of Nutrition Science and Policy at Tufts University in Boston, Massachusetts, and a bachelor's degree in science and nutrition from the University of Zimbabwe. All right, thank you all for joining us. Thank you for letting me get through those introductions. Mostly because I wanted to make sure I introduced you all as thoroughly as possible, because we're sort of going into an area that I personally don't know that much about. So I think it would be great if we could start off with you all just sharing a little bit about how you interact with the private sector and various businesses, and then also thinking about the responses that we had to that poll, if you could share how you think businesses in the private sector participate in health equity. So that was a lot. How about we start with Ms. Thomas Johnson? Could you just share with us some of the ways that you interact with the private sector, and then how you think that sector can participate in health equity?
Happy to do so, and thank you so much, Dr. Bell, for the invitation to be with you all today. This is certainly an important topic of conversation, and one that we hope will continue to evolve, because certainly the corporate sector, the private sector, has the potential to be a really important partner when we think about advancing health equity. And so for us at the American Cancer Society, our external stakeholders are really at the heart of everything that we do to end cancer as we know it for everyone. So we work with volunteers and partners from myriad backgrounds. We have a very robust portfolio of work, which involves work with corporate organizations. Many of those corporate entities that we're currently working with over the last couple of years as a result of the pandemic, which we know certainly has brought health inequities to the forefront, perhaps in ways that we had not previously seen. So many of the corporations with whom we're currently working do have health equity as a focus, and a lot of their engagement with us is around advancing health equity. And I think it's a really important conversation, because when we think about the cost of health inequity to the United States, right? It's currently at about $320 billion annually is what it costs this country. We know that there is the potential for the cost to go up to even $1 trillion by 2040. It's really important that we get the business sector involved in helping to identify solutions. So a number of our initiatives that advance health equity, whether we're talking about diversifying the healthcare workforce, which is incredibly important when it comes to making strides with closing health disparity gaps. Some of that work for us is done in partnership with corporations that believe in the importance of diversifying the workforce, the healthcare workforce. We have other corporate partners that work with us around community-based initiatives where we're doing partnerships and initiatives where we are touching communities directly to increase their education and awareness around cancer prevention and early detection. Certainly, we also have corporate partners that are working with us in the advocacy space to ensure that we are advancing policies at the state, local, and federal levels that advance health equity. So there's a number of ways that we're partnering with the corporate sector.
Thanks for that. Actually, I'm glad I went to you first because you sort of like outlined all of the like very broad ways that this can happen. And I think that our other panelists can talk about more specific ways. So I really appreciate you sharing that. And I'm actually going to ask a lot of follow-up questions based on what you just shared. So thank you. I'd like to go to Dr. Tettleton next. Because obviously the local connection here in New Orleans, but I imagine that you work with startups as well as large businesses. So if you could just share how you interact with the private sector and then also share how you think this concept of health equity is involved there.
Sure. So NOLA-BA is a public-private partnership. So we are existing in a nonprofit space, curating support for businesses in private sector, in philanthropic entities, as well as local nonprofits that have mission-based work. A lot of the mission-based work before Ida, Hurricane Katrina was heavily looking at and trying to identify and address health inequities. We had recent county health rankings that came out that New Orleans, or Orleans Parish as a whole, was doing better, but the Black population and the minority population lagged behind it. So a lot of the initiatives, especially if I can speak to just COVID, really addressed those inequities. And we saw philanthropy coming to the table to support those gig workers. So we did a large campaign called the Gig Fund, where those individuals that didn't have traditional bank accounts, that didn't have access to funds, that were really engrossed in a tourist economy that just paused and halted for over 3 years, needed immediate support and funding outside of the housing resources, the food insecurities, just the financial backing to pay next month's rent before you are even eligible, and not even starting to talk about why people within SNAP benefit range, within the gig economy, are constantly at the lowest of the poverty line, but are the backbone of the city. That's a whole nother conversation, but really, really working at trying to address just real-time needs. That was probably our biggest campaign that we did, was a gig fund economy. And we have various grants that come through JP Morgan and Chase. Kellogg supports our work within strategic neighborhoods, which I'm the project director over that. So those neighborhoods that we talked about having health disparities or larger amounts outside of the full city, we really are doubling down efforts in showcasing through businesses that I think business.com had an article in 2020 that like philanthropy or giving or having a community mission in your business is no longer looked at as a deficit, but it's an asset. So really trying to inform businesses that when you create your strategic plans, your business proposals, that you can create your community concept that has a very detailed DEI, not just tagline, but embedded within the culture of your company, even if it's a company of 1 or 2, because we deal with a lot of mom and pops, we deal with a lot of historic legacy businesses that are still going through some of the same issues as that next startup. And then we have a lot of unicorn success stories, especially around tech in New Orleans, where they're able to grow. And then when we start to look at them growing, they're growing with this mission or this mission to give back, but then they have no space to continue because they've outgrown the city. Some by space or some by the gaps in education that they're having to pull and resource talent. So when we're looking at health equity, it's the totality of the individual that really is embedded even in the business mission. So addressing their internal practices, their hiring practices, their mental health days, their leave concepts. This is a at-will state. So you have often people foregoing their physical and mental health for work. And so really working with each individual, we have a talent team that works with specific businesses that outline through their business, okay, this is your strategic plan, this is your pro forma, but how are you going to support and sustain not just the work that you're doing and supporting, but also yourself and your internal staff. We had a large company visit 2 weeks ago that employs about 250,000 people and about 9,000 managers. And they were trying to figure out what was going on, why their businesses were closing in New Orleans. And it really came to this rooted issue of youth gap, education, housing disparities. You couldn't, if you can't afford childcare, you can't go to work. And so really teaching businesses that this is a part of your model, that you should have embedded. And it's not a deficit, like I said before, but it's an asset if you're able to support and implement different practices that are part of your blueprint versus an additive when something happens.
Thank you for sharing that. First of all, the introduction to what the New Orleans Business Alliance does, but also expanding our mind to think about how businesses can impact the city, but also impact their employees and all of those things that you described about what employees have to deal with and how businesses can pretty much help people to live the lives that they want by employing in such a way that they're meeting people's needs. So I really appreciate that. Thank you for that introduction. I also wrote down a whole bunch of follow-up questions for you. So I will be coming back to you. But I do want to go to Dr. Buzingi. If you could tell us how you interact with businesses or the private sector in your current role, but then also thinking about health equity. I think yours is a little bit more straightforward. But if you could just go ahead and explain that, that would be great. So we're all on the same page.
Yes. So the Plant-Based Foods Association is the first and only trade association that represents companies that are working in the plant-based food ecosystem within the United States of America. So that's how we interact with private sector, and we kind of work to champion, strengthen, and elevate the interests of our members. And our mission within our sister organization, which is the Plant-Based Food Institute, is to kind of drive or promote the transition towards a plant-based food system that is important towards this global transition to plant-based diets that are good for the environment, that are good for the people, and that are good for animal welfare. So in doing so, we understand the important connection between health equity and food systems. When you're talking about food systems, you are actually talking the importance of food security. And in this definition, food security, it means nothing when you're not talking about equity, access, and affordability. And we know the historical injustices that are part of our ecosystem, are part of our community, in our nation, and internationally. We need to address these issues of injustice that prevents people from having good access to good nutrition. That is critical to addressing their health issues and health disparities. So our work is geared towards promoting people having access to plant-based diets, which a lot of evidence points that they help communities, especially marginalized communities, address some of the chronic health disease issues that they may have. So that's how we interact with businesses, and our members are recognizing the importance of sustainability and equity in their work, and making sure that in terms of sustainability, how they procure their raw materials, they are also addressing the needs of the communities where this food is procured and where this food will be consumed or purchased by their consumers and their members. So it's important to understand their role as businesses in this space. And I'm excited to be here, and I look forward to more interactions as we go along.
Thank you. We're excited to have you too. And I appreciate all of what you said. It made me think about this work sort of in a larger, more global way, obviously, but also even thinking about food systems and climate change and things like that. So I'm sure that we'll have lots to discuss during this conversation. Again, if you are in the audience and you have specific questions, you can feel free to put them in the chat. I will be sure to ask them. I get a prompt whenever that happens and they want me to ask a question. So no problem with that. I do want to ask another broad question to the panel. And I think it's a broad question, but I actually want you to get specific with how the businesses and organizations that you work with think about this concept of health equity? How do they define it? What are their goals? Do you have any insight onto that, or into that, excuse me? And this is for whoever, everyone.
I guess I deal with businesses on a day-to-day basis, and I think the last thing that people think to, but the first thing that they seek out is health equity within their company and their framework. And as I said before, if it's not embedded within your strategic plan, it's also kind of added to the end like a period, and not same thing with D&I or DEI, that it's not interwoven within the fabric. And so trying to embed it at the end is more costly oftentimes. It's usually coming for some of the businesses during a major crisis, especially a workforce crisis, that you see businesses really trying to adapt and support more mental health, more insurance-based policies, leave support after they've had the partial collapse of their business due to their workforce not being able to work. We saw that with COVID, but even before COVID, we had a lot of, they call it call off, no shows, no, like just this revolving door where you have so much of unemployment, and our unemployment numbers are very interesting and very tricky, even though even the national numbers say that there's the lowest unemployment that you have, but people with inflation are working more jobs. And you had a decrease in unemployment for Black males, but an increase for Black females. So it's almost like you're trading off in the numbers oftentimes. But we have businesses seeking health equity as a solution, usually to a problem that they've encountered with someone in the workforce versus something embedded, or a champion, like we have American Cancer Society champions, American Heart Association champions after a stroke has happened, after they're championing an issue in the reactive nature of it versus having a proactive system embedded. And so especially the mom and pop organizations and businesses that you see, that I think once people provide healthcare, they're like, we've done it. We've provided healthcare, or we've done it. We've provided a livable wage over $7.25, but not knowing so many people are exempt from that. Those that are tipping situations that are exempt from that minimum wage, that they're still encountering some of the same health issues and not understanding why. It's not until they get to the root of it. Most businesses that we work with don't have HR. They don't have the CEO or the owner is wearing all of those hats. And so it's really hard to address it up front sometimes. And so we're trying to make it a point to speak to businesses when they create their strategic plan to embed some of these health equity systems so that at the end of the day, they have it in the first part.
Yeah, I think that's a good point too, just thinking about how our health is more than just access to healthcare. Like, we need that. Everyone should have access to healthcare, but it's so much more than that. And so thinking about how businesses and other organizations can be involved in meeting those additional needs outside of healthcare, because it's definitely much more than that. Thank you. Ms. Thomas Johnson, could you expound on that? Are there specific sort of definitions or understandings of health equity that you're coming across when you're interacting with the groups and businesses that you interact with?
Yeah, I'm happy to chime in here. I certainly agree with what's already been shared in terms of, the approaches that smaller businesses are taking. But when we look at larger corporate structures, global entities, a lot of them are thinking about health equity through the lens of their corporate social responsibility work, right? So there is, increasing pressure that corporations have, not only from their employee base, right, who are saying these are the things that we need to have in order to ensure, productivity and to have, strong employee engagement and satisfaction, and that's what's going to help us stay with your organization. So there's that internal advocacy that we see from the employees, that employers are having to respond to in terms of, the benefits and services that they provide. But when you look at it through the lens of their boards of directors, right? So there are external stakeholders that are saying, we want to understand what your social impact is. And a lot of that over the last few years is related to health equity. And so There's also been this evolution of corporate social responsibility work now into what's called ESG. And a lot of what we see under social impact relates to issues and topics that are material to health equity. So it's an interesting time to be having these conversations because there's both the internal pressure that organizations have, and then there's the external pressure from their external stakeholders that are really looking at not only, the profits, right, in terms of revenue generation, but what good are you doing in the community? What difference are you making? What is the social impact that you're having on communities and on the customers that you serve? So it's really, I think, a growing conversation. I know there's been some really interesting work that's come out of Deloitte to help organizations really tie in health equity into their board of director roles and responsibilities so that they're training board members now to really apply a health equity lens to their governance responsibilities as members of corporate boards. We're certainly not a corporate board, but we do have a board of directors that guides the work of our organization. And for us, health equity really is foundational to everything that we do, right? And so it's integrated into all of the pillars of our work. And when we think about it through the lens of our staff, our volunteers, and then also our board, we have a committee that's focused on ESG. There is an ESG subcommittee of our board to ensure that we're hitting the social impact that we should have as an organization serving cancer patients and their families.
I wanted to sort of ask a sub question or a follow-up question about this concept of ESG and some of the things that you were just talking about, Dr. Tettleton, and also thinking about the food system space, Dr. Muzingi. Where is the energy for these types of conversations coming from? And I'm thinking about, are there ways for communities, for other sectors like healthcare? Well, maybe American Cancer Society is very much involved in healthcare, but are there ways for us to be thinking about how different sectors can be a part of that push for social responsibility in the business realm? And I even maybe for Dr. Tettleton and Dr. Muzingi, thinking about how government might interact with you all's conversations around social responsibility in businesses. Is there any of that going on? Who's leading these conversations?
Yeah, in the food system work, there are current discussions in terms of ESG commitments as it relates to sustainability. I think everybody right now is aware of the global challenges that we are facing as a result of climate change. And climate change is driven primarily by the way in which we produce food and consume food. So studies show that close to 33% of the greenhouse emissions come from the food systems activities in agriculture. So a lot of the energy is coming primarily from consumers willing to take actions to change the way they eat so that they can contribute to a planet that is good for their children and good for themselves. And also the other thing is we have a health crisis that is kind of diet related. Most of the chronic diseases that we have are driven by how we eat food. And so food is a big contributor to some of the health problems that we have. And also the way we consume food, depending on who you are and the structural injustices that are in the system, can expose different groups, different communities to these chronic diseases. So there is a need, an urgent need right now to kind of promote healthy eating and access to safe and nutritious food to many of the communities that we serve. So the energy comes from a sustainability perspective where people want to contribute towards addressing these issues related to climate change. and also from a health outcome perspective, where people want to eat well so that they have desirable health outcomes. So the nutrition messages are really important. And our work is kind of driving towards advocacy, in which we can work with different governments at state level, at federal level, at international level, so that these governments can actually create policies and create an enabling environment in which innovations can thrive within the food systems, whereby companies that are working, for example, in the plant-based space can create products that meet the desires of the consumers, but at the same time are nutritious and contributing to their health needs, and are also good for the environment, good for the planet. They are not contributing to deforestation, or maybe issues that are social issues that are important, like child trafficking, human trafficking, some of those injustices that are part of the food systems. So the energy comes from the way we eat food, the way we consume food, the way we process food. So we need this huge shift in the food system transformation so that we can have a future at the end of the day. So that's where most of this energy is coming from within our sector, so that we address the health issues and we also address the planetary issues. But there are a lot of challenges that we face right now. We need to have access to information among our consumers. And depending on where you live, depending on where you are, some people do not have access to information about how to consume these safe and nutritious plant-based foods. And in some cases, we also need access to government subsidies that can promote different sectors, different commodities. We know other sectors have benefited from government subsidies that kind of promote their commodities, but we need the government also to provide the same incentive so that the plant-based movement, the plant-based commodities can be available to people who need them so that they can improve their health outcomes. So these are some of the challenges that we are trying to address within the food system space, in advocating for more attention, more resources, and more information and access among all people globally and in different communities that are marginalized.
I was going to just say, I think the ESG realm is, I feel like in the early 2000s, right before the crash of 2008 was like a fancy term that people used and embedded it within a lot of their work. But now with some of the governmental regulations, speaking for the United States specifically, that, and we can refer to the EU as well, which is a little bit more restrictive, that it's pushing that quote unquote fancy word into actual need and governance. And it's making restrictions so that if you don't have that corporate responsibility, that environmental responsibility, that social impact within your work, you can even see your stocks plummet. You can see your stocks go down. You can look at, for better or for worse, some of the top ESG companies like Microsoft, and you can see their corporate responsibility, their social impact statements, the money that they've given in. There's a group of billionaires that have compiled data to analyze the top, like Deepak Chopra is in it, Huffington is in it. So take the lens as it is, the biased lens that they're coming from, but they use data and stats to analyze these companies and to look at the top companies that are ESG focused. And you often see that governmental regulation, and I know we're talking about businesses, but it's kind of this ebb and flow where government regulation is pushing some of the changes and the bottom line of the consumer. And so that's where the community impact is very heavy, especially if we look at the local lens, that the consumer can push and move the needle, especially for a smaller business. And we've seen grassroots increase to, you know, policies at the national level. So we can see a movement starting and addressing healthy eating or not eating sugary foods or drinks, and that's now embedded in your city council and your policy. For better or for worse, if they have one where they tax more the sugary, but when you do a positive impact where you're actually maybe giving other options, alternatives, you see a change and shift in that next generation. And so a lot of this, I feel like you're seeing changes and shifts over time. I heard somebody in Ulta that was 16 saying they will not look old like their mom because they wear sunscreen. So sadly, that's the example of some practices and things and knowledge embedded in regulations, or you being self-regulated based on knowing more, that it employs you to not just be a quote unquote good human, but you have some standards and practices that are embedded in regulatory principles that you have to follow.
First of all, thank you for the Ulta anecdote. That's always, I think it's applicable actually to consider the real world ways in which we can shift change. And I appreciate all of you for lifting up how government as a sector can be involved, as well as community, and really thinking about both on the large scale, big company level, but as well as on the small, on a smaller scale, not that they're insignificant, clearly. I do want to ask a question that Dr. Mazingi actually used the word challenge and brought up that idea. And I'm wondering if there are specific challenges that you're coming across or that you hear in this realm, the private sector business realm, that they might have when trying to address or be involved in the health equity space. Are there specific challenges that are coming up, and are there ways to overcome those challenges?
Yeah, I'm happy to start there. We have a wonderful partnership with Bank of America, and I'm going to name them because we're really proud of the investment that Bank of America has made in health equity. They announced a $25 million investment 2 years ago in health equity, and it's the first time that the bank has ever actually invested in anything in the health space. And so it's a partnership that we have with them, along with the American Diabetes Association and the American Heart Association. And it's really organized around 3 pillars. One is education and outreach into communities to educate them on cancer prevention, heart disease prevention, diabetes prevention. There is a component around what we call access to care, and that's linking individuals in the community to preventative screenings and care. And then there's the advocacy piece, the policy piece that happens sort of at the local level. And so we're working across 11 markets with 3 national healthcare health nonprofits, as well as a large financial institution. So you tell me where the challenge might be with that, right? So it's really kind of getting everyone on the same page. I think we, we're in year 2 now. So we spent year 1 building capacity. And really that was just understanding, what does it mean to advance health equity? It's such a big topic that I think all of us in organizations that are doing good in the space, come to it despite the good that we're doing with different understandings and different approaches, right? And so in working with the corporate sector, part of it is, there's a learning curve, right? They have to learn what they don't know, particularly as it relates to the community engagement piece, which for many of us that, come from a community engagement background, understand that that's critical, right? That's at the core of addressing health inequities. And so I think, that's a challenge. It's an opportunity, certainly one that we have made progress with and we're very proud of. We're now, we've done all the capacity building and we're out into communities now beginning to do the outreach and engagement. And it's a 4-year initiative that we hope will continue for many more years to come. So wanted to share that and also shout out Bank of America because we're really proud of the investment that they're making in health equity.
Yeah, I'll go within our space, within the plant-based food ecosystem. Some of the challenges our members are facing, or the whole ecosystem is facing, is that of misinformation, disinformation, and underinformation. And this is applicable across all aspects of health equity, whereby low-income consumers, people of certain demographics are specifically targeted, and they don't have good access to information or are given wrong information. So we are facing the challenge in which people don't have good access to information that can help them make informed decisions about their health and the nutritious aspects of the product they're consuming. So we would like to make sure that people, consumers, have access to the right information all the time so that we can address some of these health inequities that exist within our nation and globally. And also, the food system is not, we do not require silver bullet approaches. We need a holistic approach to address these common global challenges. It's not about one person being wrong or one sector being right, but it needs all hands on deck. So we need more collaborations, more partnerships, and less attacks and just silos and being myopic. So these are some of the challenges that we are facing, where people are working in silos, people are pursuing specific interests, but this is happening at the impact of the whole society. So now is not the time for squabbles. Now is the time to approach different tools that can work to address the climate change challenges that we are facing, the health challenges that we are facing. And what we represent is one of those tools that we think can make a significant impact in people's lives and in the community. So we need more collaborations, we need more partnerships across the board so that we can contribute to the future of our children and our grandchildren. Yeah.
I'll say 2 quick seconds. I think there's a lot of challenges when addressing health inequities because we're looking at trying to address social determinants of health through a 5-year plan or through a 3-year stipend of funding. And we're trying to address and deal with issues from 400+ years. And I often see funders, philanthropy, government, federal, all of the money trickle down within a time period, within an instance, or within a major disaster, for example, in New Orleans. And you're trying to create these embedded strategies that once you're able to lift off from year 3 to 4, you're not able to continue. And so that creates this distrust within the community. I often hear in New Orleans, they're like, we're always surveyed. Everyone's always coming to ask us a survey, a question, a thing, or this or that. You know, health disparities, you know, the average age or lifespan of someone Black is 25 years less in Lakeview versus Treme, which is in a neighborhood that's frequently put on TV and visit and just is plagued. And you're trying to address someone's work and how they live when they're just trying to live. And so oftentimes those social determinants of health measures used, and what's impactful when you start to try to move the needle, your funding gets started to be pulled. You have shifts in policies in government. And so that sustainable model has to have a collaborative with a common goal image that is continual, that's not of a elective year. It has to be something that transcends. The work that I'm doing when I was at another agency is in the same space that I'm doing now. And so you have to have those champions, those leaders, but you at the core, like Tawana said, have to have community. And if you don't have a community that can trust you to be a steward leader, then you don't have the capacity to move the needle because you don't have that backing from those that you're trying to actually impact positively.
That was deep. Actually, I'm glad that you sort of rounded that out because literally you all talked about a spectrum of things. And sort of from these big corporate entities down to what's happening in our local neighborhoods, particularly here in New Orleans, but I'm sure in other cities as well as rural context. And then thinking about just a huge array of challenges that can happen. I think I want to close though with you sharing something that you're proud of, like a success in this arena that we can sort of build on, even potentially towards sustainability. That's what a term that you all have been saying multiple times, which I think, we're all going to latch onto. But is there a quick story or something that you want to highlight of success that can really obviously launch us into moving forward and doing this work ourselves, but just might demonstrate some of the ways that we can have success in this health equity business arena? Anyone want to share?
Well, I can say I'm really proud of the the young people, most termly Gen Z. They are kind of taking charge of their future, and they are voting with their mouths. So they are making the right choices in terms of what they purchase, how they eat. So they are putting sustainability at the front of their priorities. So in our sector, the growth is driven by these young consumers, and they're advocating for stewardship of our environment. So that's a huge thing. And I hope our colleagues across the sectors, our policymakers, will continue to listen to the young people so that they can respond to their needs. And I would like also to say that there are a lot of young people across the globe who are becoming entrepreneurs, designing food products that are culturally appropriate, so that there is also representation in terms of choices, so that everybody get to enjoy the type of plant-based food they desire according to their kind of culinary preferences, so that there is more choice, more diversity in the diet space, so that people can improve their health outcomes and also be happy about the role they're playing in kind of stewarding the environment that we have. So I'm really proud of the young people.
Well, I share that pride. We're talking to folks that are based in New Orleans. My family's from New Orleans. And so, Tawanda, I had to learn probably about 4 years ago from my son, who's a vegan, how to make vegan gumbo. That was like, what is that? It was such an anomaly to me, but we learned how to do it and we enjoyed it. So I think you're right. I think our young people are leading the conversation and leading us in some really important ways. The other thing that I think that, we're proud of when we sit at the table with corporate partners is that I do think that they are listening with a different ear, right? Perhaps than what we heard or saw, early in my career. I think that the conversations are happening in more nuanced ways, which can lead to greater impact and sustainable impact. To Dr. Tettleton's point earlier, it's not enough for it to be a 4-year initiative or a 6-year initiative. We've really got to look at ways to work in partnership with corporations that get at the systemic and the structural issues that perpetuate health inequities. So I am, hopeful that what we're seeing in these conversations will lead us to more sustainable and true tangible impact as it relates to closing disparity gaps.
I can just say ditto for what the panel said, and then also with the servant leaders of the young, as others come in, we're happy to share. And it's the old guard, new guard. That's not really a concept. It's really just sharing. And you're seeing people that are sustaining in the movement, not being burnt out, that can pass that knowledge along. And because this is a long game, this is something that you see people that you've seen decades ago still passionate about the work, still continuing to do the work. And that's something that is uplifting, that you don't see people burnt out and burdened by the work, that it's just each needle that we kind of push and move, you have that positive outcome. And I do see the philanthropic shifts and changes, and I hope they continue to expand, even with programs, specifically a baby of ours at NOLA VA called Resilient Corridors Initiative, who thought that $5,000 grant during COVID would help businesses sustain over a multi-year period. And if you could see that impact with 40 businesses, that none shut down, and over 63% didn't receive any federal loans, any dollars outside of that, even though they had the criteria. So you have those disproportionate lending practices, those racial disparities, that you're still able to, if you create an equitable system or you create an equitable program to launch them, you can see how they grow. And so that's something that I'm always proud of. Even the event rental spaces, to the junior league youth opportunity youth programs, to national food chains or food chains that were local staples growing to nationals. Like, I didn't think Weedax would be a sauce that would be in over 300 HEBs, but we're here now. And those are just positives that you can see, and continues to help me push through the mission and the work.
Awesome. Thank you all really for sharing your experiences, your work. I've learned a lot. I think that we all want to reflect on how this pushes us forward and sort of what are the next steps based on this. So I really just want to thank you all. We really appreciate it. So with that, we're actually going to conclude our session today, but invite you to join us on Tuesday, June 20th for our panel discussion on partnering with health equity advocacy groups, which is being presented in collaboration with Community Campus Partnerships for Health. Also, registration is now open for our next workshop sprint titled Research Synthesis for Evidence-Based Health Policy, which starts on June 28th. More information about our upcoming activities is available on our website. You can follow us on social media and help us spread the word by sharing our content that most interests you and your work. See you soon.